Hi everyone, good morning. Today is March 15, 2020. It's a Sunday morning. So welcome to our course. We have the Geriatric Nursing. So today we are going to discuss the topic about palliative care and end of life care. So here, if you are going to understand with the first slide that we're going to view, what is palliative care? How you are going to take good care as a nurse to a patient who is terminally ill, almost they're waiting for their grave, they're waiting to die. So how you are going to alleviate, how you are going to manage everything for our centered care to our patient. Now, class, in knowing this, in understanding this, we are going to find out that after the discussions, after the class that we have, now there are learning objectives you should know. You should be able to define what is palliative care and end of life care. You are going to list what are the goals and characteristics of palliative care. You will be able to identify what are the multidisciplinary team responsible to provide palliative care working in the hospital. So you will be able to illustrate the patient needs of their end of life. You will be able to demonstrate how to make a nursing care plan or how to implement nursing management to a patient who is terminally ill. And somehow, the last will, you will be able to implement the nursing measures to manage physiologic responses to terminal illness like pain, dyspnea, suffered by our patient. So here, first we are going to define what is palliative care. This is defined as the active, total care of the seriously ill patient whose disease is not responsive anymore to treatment. Palliative care for end of life is the provision of care aimed at relieving suffering and improving the quality of living and dying. So this model of care is appropriate for any person at any stage of life-threatening illness, regardless of age. So what are the goals of palliative care? First, as a nurse, the goal is to relieve and prevent suffering. If you are going to understand, if you're going to assess objectively to our patient, so they suffer so much because of their illness. Second, you will be able to involve people important to the patient, promote a degree of acceptance by the patient and family. You are going to provide a process of care that guides the patient's understanding and decision making. And somehow, you'll be able to achieve a peaceful death. And you will be able to provide what is the nature of bereavement and support for families and loved ones. So what are the characteristics of palliative care? First, that is patient-centered. Second, that is family-centered. That is comprehensive. That is continuous, coordinated. And then there is teamwork, working in the hospital there. And then there must be a regular review. So in palliative care, we emphasize on management of psychological, social, spiritual problems, and to control of pain and other physical symptoms. So end-of-life care is defined as an active approach that treat, comfort, and support person who are living with or dying from progressive or chronic life-threatening conditions. So you will be asking a question if you are going to work in the hospital setup. Who are the multidisciplinary team that are with you? So expect you'll be working with the medical staff, registered nurses. we have the physiotherapist, we have the occupational therapist, we have the dietitian, we have the counselors or psychologists, and then we have the volunteers and others. So we have a method of stating the end of life preferences, one called as advance directive. This is a written document that allow the individual of sound mind to document preferences regarding end of life care that should be followed when the signer is terminally ill and unable to verbally communicate his or her wishes. So these documents are generally completed in advance or during serious illnesses. So what do people need during the end of life? So there must be communication. This is very important. So this can be verbal, spoken, or it can be non-verbal. They call that as body language. So we have the second, physical comfort. Many patients at the end of the life are in pain. Some need analgesic and other pain relief care. Many may be chilly or feel cold. They may also lose control of their urine and feces. Patients at this stage in the end of life, really, they need physical care and comfort. So aside from that, we have the third, mental comfort. Some people may be very sad or depressed during this stage. Others may be afraid to be alone in the room. Many people accept the fact that they are dying. So next is we have the spiritual comfort. So people may want to pray and read the Holy Scriptures. Others may not be spiritual or religious at all, but at least now this will give them relief. This will give them diversion. So we have the social needs now, terminally ill patient needs. Sadly, many old people and very ill people do not see or hear from their family or friends as much as they did in the past. They may feel lonely, unloved, and not useful or important. So we are going to encourage the family members. They are going to do what we call as communication, interpersonal relation, and then somehow this will bolster the morale of this ill patient in facing death. So we have the financial needs. Care in the home, hospital or nursing home costs a lot of money. During the end of life, many people worry about how they are going to pay for their health care. Some need help from a social worker or community agency to meet these financial needs. So if you are going to see this picture, nursing care of the terminally ill patient and end of life care. So we have a patient here. The scenario will be this may be at home or this is in the hospital. So we can see the family members. So they visit the patient. So they are showing, they are manifesting the support for their loved one. So next is, as a nurse, you should know how to formulate nursing diagnosis of the terminally ill patient. So based on the NANDA, so NANDA has the what we call as problem format. You are going to follow with this, and then somehow based on your nursing care plan assessment, you are going to relate this with the etiology, what are the causes, and then based from your subjective and objective assessment, you are going to connect the evidences, the manifestations of the patient. So we have the number one, it may be chronic pain related to progressive disease, immobility and organ failure. We have a nursing diagnosis, ineffective breathing pattern related to progressions of disease process, or it may be psychological, disturbed thought process. This is related to disease progressions and altered metabolic state. or medication side effects. So it may be a nursing diagnosis about fear, anxiety related to life-threatening condition, pain, death, and patient's concern that he or she will be forgotten. So we have the powerlessness related to actual debility and inability to carry out normal rule functions. So it may be knowledge deficit about progressive disease process and expectations as death approaches. So it may be about fluid volume deficit related to inability to regulate food and fluid intake and output secondary to disease progression. Why? Because patient at the stage they don't like to eat. They're anorexic already. Almost everything they don't like anymore. So as a nurse, you are going to see to it what are the risks for altered nutrition, less than body requirements related to anorexia, nausea, vomiting, impaired swallowing, and aspiration risk. So those are the example of nursing diagnosis you are going to study and identify if ever you will be in the hospital working with the terminally ill patient. Now, as a nurse, what are the nursing care of the terminally ill patient now in their end of life stage? So we are going to we are going to situate now all of this as much as possible. You will be able to deliver this to the patient. First, we have the psychosocial aspect. Second, communication. Third, managing physiologic responses to illness. Fourth, we have the physical comfort. Fifth, we have managing receiving bad news. Sixth, we have mental comfort. And then we have seven, spiritual comfort. And we have the financial needs, which is the last, about how to give care of the terminally ill patient. Now, let us do this. Let us understand this one by one in order for you know how to implement this to your patient. So we have the number one when it comes to psychosocial issues. So here, nurses are responsible for educating patient about their illness. So that's why there's a time allotted when you will be in the hospital having your duty. You are going to carry out the health teaching plan. So you are going to spare time, and then somehow if the patient can't listen, cannot talk anymore, you are going to discuss this with the family members present in the room. So in psychosocial issues, you are going to support them as they conduct life with you and end of life closure. So nurses here need to be both culturally aware and sensitive in their approaches to communications with patient and families about that. So try knowing with the diversity of culture. This is part of the fundamentals of nursing. Now you are going to find out first the history of the patient. So if you know what's the culture, you're going to study, and then you are going to align with this one because they are sensitive, especially in this case, terminally ill patient. So regarding psychosocial issues, you are going to appreciate and understand the illness from the patient's perspective, not now in the nurse perspective, in the patient's perspective. So you are going to discover what type and amount of disclosure is most meaningful to each patient and family within their unique belief system. So you are going to encourage also visits as people at the end of life have a desire for closeness. So they long for closeness, they long for visit even though they're not speaking anymore. But remember, the last sense of the patient when they're about to die is the sense of hearing. They cannot communicate, they cannot talk, they cannot see somehow, but somehow they can hear what the family members are talking within the room. So you must be sensitive with this one, and then you are going to educate family members regarding this, because There will be instances, they will be talking something sensitive or something it will hurt with the patient because they thought the patient cannot hear anymore. So you as a nurse, this is one of your responsibility to let them know that the patient still alive and then still can hear what you're talking. So you are going to talk for the good of the patient appropriately. So here, the next is in communication, how you are going to communicate. You are going to spend time with the patient and family. You are going to listen what they have to say. You are going to speak in a kind and respectful way. You are going to answer their questions if you can. But if you can't answer that question, you may need help as a doctor or any professional to help you as a nurse and then explain that to the patient. So you are going to realize that the best time for the patient to talk may be when it is least convenient for you. So you are going to be fully present during any communication. Is often the most helpful form of communication. So your mere presence is very important. That's a non-verbal language that will somehow give a moral support to the patient. So aside from that, in communication, you are going to use body language that shows caring and respect. You are going to do a gentle touch. You are going to hold the person's hand and just spending time. That will show you're caring. Do not cross your arms, tap your feet, or show other signs of being hurried. So you must be gentle. Now you must be loving and caring at this point of time. So you're going to communicate with the patients that are in coma or unconscious. Do not treat unconscious patients differently from those that are awake and alert. So the same, if you're caring to the conscious patient, that is how you're going to care. Much more in the unconscious patient. Do not ever say anything that you do not want the patient or resident to hear. Hearing, remember that one, is the last sense to die at the end of life. So, how to manage physiologic responses to illness? So, this is one. Now, there are symptoms and terminal illnesses that may cause because of the disease, because of the treatment of the disease, coexisting disorders that is unrelated to the disease but are related to the aging. Just for example, we have pain, difficulty of breathing, which is dyspnea, loss of appetite when patient is in the anorexic condition. So the causes of suffering is we have here. Try to focus on this schematic diagram. So the total suffering, now we have the pain, we have the physical symptoms, we have the psychological, we have the social, cultural, spiritual. These will all point, and then this will sum up to the total suffering of the patient. So plus here, we have the interdependent causes of suffering. We have the one segment of pain. Pain will cause spiritual influence, will influence the physical symptoms, pain to psychological, pain to social, and then pain to cultural. So when you say interdependence, this is both vice versa. So if you are going to, spiritual will cause pain, cultural may influence pain also, social, psychological, and physical symptoms. That will point, and then the total suffering that will cause the pain of the terminally ill patient. So how to manage physiologic responses to illness? Our goal here, symptom management of the end of life, are to completely relieve the symptoms as much as possible. If not, you are going to decrease the symptoms to a level that the patient can tolerate when it cannot be completely relieved. And then medical interventions may be aimed at treating the underlying cause of symptoms. Now, here, this is essential also to know as a nurse how to manage the pain. Remember, pain is now called the fifth vital sign if you are caring to a terminally ill patient. Remember, there are four vital signs. Usually work, usually shut down and do the objective assessment to your patient. We have the temperature, the respiration, the pulse rate, the blood pressure, and then we have the fifth, the vital sign for managing of pain. Patients should be checked for pain often, or if not often, regularly. Now, based on what is the prescription from the doctor. And then aside from that, now you have the discretion as a nurse, how many times you are going to assess the pain of the patient. Second, you are going to provide a quiet room, a back rub, you're going to provide a holy scripture, or even soothing music to patients that are in pain. So this may help them divert their attention on the pain that they have. You are going to allow the person in pain to speak to you, spend quiet time with them. Patient to have an established regimen of analgesic. You are going to continue to receive these medications as they approach the end of life, and then you are going to administer this to your patient. So patients have been receiving opioids should continue to receive equi-analgesic doses via the rectal or sublingual routes. So aside from that sublingual, we have patches now that will enable the patient to relieve his pain. So remember, class, that when you are going to use the categoric scale or numerical scale of finding out what is the number of pain patient is experiencing at this time is, that is 7, 8, 9 up to 10, or 8 to 10. So severe pain to the worst pain that they experience. So here we are dependent on the pain reliever prescribed by the doctor. So as much as possible, we are going to pay attention on this one and then administer this to our patient. Analgesic administered orally or rectally are short-acting, typically scheduled as frequent as every 3 to 4 hours around the clock. So aside from that, the nurse should teach the family about the continuation of comfort measures as the patient approaches the end of life. If the patient is at home, family members administering analgesics need to be prepared for this possibility. How to administer analgesic via alternate routes. How to assess the pain when the patient cannot verbally report pain intensity. So, after knowing how to manage the pain, if the patient is suffering from dyspnea, which is difficulty of breathing, patients with primary lung tumors, lung metastasis, we have pleural effusion, and restrictive lung disease may experience significant dyspnea. The treatment of dyspnea varies depending on the patient's general physical condition and imminence of death. How to assess? These are the things, these are the parameters you should know as a nurse. The severity of symptoms, you're going to assess, auscultate the lung sounds, the fluid balance. We have the measurement of dependent edema. Patient with this, now they are not responding well to medications anymore, and then they are edematous. You are going to measure the abdominal girth, the temperature, the skin color, the sputum quantity and character, then how they cough, the severity of cough that they have. So from this, you are going to administer medical treatment for underlying pathology as prescribed related to dyspnea or difficulty of breathing. You are going to monitor the patient's response to treatment. You are going to administer the low flow oxygen often provides. You are going to assess the patient and family, how they manage anxiety. So this is the psychological aspect of the patient, you should know. You are going to alter the perceptions of the symptoms. And then as much as possible, you are going to know how to conserve energy. How to manage a patient with difficulty or they lost their appetite, anorexia. You are going to initiate measures to ensure adequate dietary intake without adding stress to the patient at meal times. You are going to assess the impact of medications. If the patient is having cancer, they're having chemotherapy or other therapies. We have the radiation therapy that are being used to treat the underlying illness that they have. You are going to administer and monitor effects of prescribed treatment. One thing you should know as a nurse, before administering any medications, you should have the background knowledge for all this, especially the side effects, the mechanism of actions in these medications, for you not to panic when there will be a manifestations of nausea, vomiting, and delayed gastric emptying of the patient. You are going to encourage the patient to eat as much as possible when the effects of medications have subsided. So aside from that, anorexic patient, you are going to eliminate unpleasant odors and other factors that cause nausea, vomiting, and anorexia. You are going to remove items that may reduce appetite, such as soiled tissues, bedpans, emesis basins, clutter. These are items that will reduce the appetite of the patient. You are going to assess and manage anxiety and depression to the extent as much as possible. You are going to position to enhance gastric emptying, assess for constipation. You are going to manage the constipation, and you are going to provide frequent mouth care to patient with terminal illness. Regarding how to give physical comfort, you are going to give the person their bath and provide very good skin care. You are going to keep them clean and dry at all times. Provide them very good mouth care. The patient may be dehydrated at this time and have a dry mouth. You are going to use mouth swabs. Unconscious patients that have dry mouth, you are going to give sips of water to patients that are conscious and able to swallow safely. If the patient cannot swallow, laxatives or stool softeners, rectal suppositories, or enemas may be necessary. If the patient is suffering from fever, okay, you are going to give in a form of suppository also. Now, aside from that, in physical comfort, you are going to turn and position the patient at least every 2 hours. Many dying patients are at risk for pressure ulcers. Remember, pressure ulcers are one of the signs they haven't received a good care from their nurses. So you are going to turn the patient side to side if they are immobile already or something, so to avoid these pressure ulcers. Keep the bed and the room neat. Adjust the temperature in the room if the person is too warm or too cold. Then you are going to dim the light to stimulate sleeping or to stimulate rest. So in managing receiving bad news, the most important intervention the nurse can provide is you are going to listen empathically to your patient. What are the keys to effective listening? Remember, this is the time you are going to use what you have learned in communication skills. The type which is called as therapeutic communication technique. You are going to resist the impulse to fill the empty space in communications with talk. Allow the patient and family sufficient time to reflect and respond after asking a question. Avoid distractions such as noise or any interruptions. If you can remove, but if not, you are going to minimize. How to manage receiving bad news? You are going to prompt gently. Do you need more time to think about this? So you're going to avoid the impulse to give advice. Avoid canned responses, such as you will say, I know just how you feel. you're going to avoid this one. Ask appropriate question. You are going to summarize and review for the patient to understand if patient can still respond or patient can still hear. Now, when it comes to mental comfort as a nurse, how to do this? You are going to listen to the patient, resident or family members. Spend time with them. Allow them to express their fears and concern. Keep the nurse call bell in reach of the person so they can call for help if they need it. So you are going to observe the room. You are going to check if the call bell is working. So at times you are not present in the room. Anytime they can call you because from time to time they need aid or help from nurses. Allow the person to do their end of life tasks like calling their family, if they can call, speaking to their attorney or anybody, their loved ones. Make the person feel loved and cared for. As a nurse, you are going to report any signs of mental distress like crying, shouting. The next is how to give spiritual comfort to a terminally ill patient. This is a word, respect the need for spiritual support. Do not force your own religious or spiritual beliefs on the patient. People have the right to choose their own belief. This belief must be respected. And you are going to provide a quiet and private place for them. The last one is how to help them when it comes to financial needs. You are going to tell the social worker if the person is worried about their money or financial needs. Social workers often help them with this and other matters, such as writing a will or advance directives. So in the last sub-concept we discussed already, now what is advance directives and then how to do this. So class, this is the last portion of our topic discuss palliative care, how to give care to a terminally ill patient in their end of life stage. So aside from the presentations that I have and video lecture as a source of our virtual learning, we have the references. Give time, browse this to the hybrid library, and then study more for you to understand fully about palliative care. It's all from this. Best wishes. Bye-bye. Thank you. Study.